Ryan Hurljack was in first grade when his teacher explained that people were sick, and some were even dying because they didn't have clean water. He knew that he could make a bigger difference. So he chose to save $70, so a school in Uganda can have clean water. But he realized that it would actually cost $2,000 to build a well in a place like Uganda. There's where Ryan started speaking to service clubs, school classes, to actually anyone who would listen to his story, so that he could raise money for his first well at Hangalo Primary School in Uganda. That's when his Grade 1 project became the RsW Foundation. And by 2014, 6 years after Ryan's first well, there are now over 800 wells drilled, 1,100 latrines constructed, and over 750,000 people helped in 16 countries. The RsW Foundation's mission statement is to provide access to clean water, sanitation and hygiene education in the poorest regions of developing countries. We educate and motivate people to share our passion and contribute to achieving change in the world.
The RsW Foundation's BUILD program supports water, sanitation, and hygiene education projects in partnership with local, non-governmental, and community-based organizations in developing countries. Our current focus is to the communities of West Africa, East Africa, and Haiti. Some examples of our current projects include sanitation access in Burkina Faso. Since 2006, RsW and Orzone have worked in partnerships to support water and sanitation access in Burkina Faso. To date, over 26,000 people in Burkina Faso now have access to safe water and sanitation. We are able to build latrines, drill and construct a well, install hand washing machines, and train the management committee. In addition, RsW has partnered with the Albert Schweitzer Hospital in Haiti to bring stability to the lives of thousands. Together, we're able to make sustainable water and sanitation projects. Currently, with donations, we're able to rehabilitate 5 previously built wells, construct 50 to 60,000 liter rainwater harvesting tanks, as well as manage roof repairs to the Doikun Primary School in Haiti. Some examples of our past projects include the Seasonal Giving Project, Water and Proper Sanitation. This project took place at the Adwir Health Center in Uganda. The goal was to create a safe environment for expecting mothers to deliver their babies. We were able to provide a deep borehole well, 1 permanent hand washing station, wash training for clinic staff and the surrounding community, as well as training for 5 local pump and mechanics. In addition, the Watoto World Center well project in southern Kenya was completed in 2015. This children's orphanage was slowly becoming limited with resources. With the help of the RsW Foundation and donations, our organization was able to provide clean water to the children at the orphanage, as well as provide irrigation for the gardens that feed the community. These projects, past, present, and future, have great effects on people's lives. Rather than walking long and often dangerous terrain in search of water, children are able to spend more time in school. These initiatives have reduced the risk of severe and debilitating diseases and even death, particularly amongst young children. At any given time, half of the world's hospital beds are occupied by patients suffering from a water-related disease. More people have died because of poor water and sanitation than those who have died by guns in war. In fact, every 20 seconds, a children under 5 dies from a water and sanitation-related illness. That's close to 5,000 children a day. Water-related diseases can be divided into 4 categories. Waterborne diseases. Waterborne diseases, including cholera, typhoid, and dysentery, are caused by drinking water containing infectious viruses or bacteria, which often come from human or animal waste. Number 2, water-washed diseases. Water-wash diseases such as skin and eye infections are caused by lack of clean water for washing. Number 3. Water-based diseases. Water-based diseases such as schistosomiasis are spread by organisms that developed in water and then become human parasites. They are spread by contaminated water. Number 4. Water-related insect vectors. Water-related insect vectors such as mosquitoes breed in or near water and spread diseases including dengue and malaria. As you can imagine, these diseases pose dangers, especially in poor countries who are lacking proper preventative and treatment technologies.
How will your donation to our foundation help? Well, donations are always needed, and with your help, RsW will be able to spread our services to even more countries worldwide. Reaching more people, we aspire to take on projects such as the drilling of 5D borehole wells, intensive wash training at all locations, construction of lanterns, and hand washing at schools. Why should you even consider the RsW Foundation? The RsW Foundation is extremely impactful. It truly changes the lives of those we reach out to exponentially in so many ways. Some of the many ways we improve the lives of people include health. The diseases from dirty water kill more people every year than all forms of violence, including war. 43% of those deaths are children under 5 years old. Access to clean water and basic sanitation can save around 16,000 lives every week. Education. Clean water helps keep kids in school, especially girls. Less time collecting water means more time in class. Clean water and proper toilets at school means teenage girls don't have to stay home for a week out of every month. Time. In Africa alone, women spend 40 billion hours a year walking for water. Access to clean water gives communities more time to grow food, earn an income, and go to school, all which fight poverty. Women empowerment. Women are responsible for 72% of water collected in sub-Saharan Africa. When a community gets water, women and girls get their lives back. They start businesses, improve their homes, and take charge of their own futures.